Nln Nex Exam. Question 1. A nurse reads, patient reports pain 8/10 in lower right quadrant. What first? Notify physician immediately. Administer antacid. Perform focused abdominal assessment. Encourage water. Assessment first before intervention. Pain in LRQ could be appendicitis. Nurse must assess before notifying MD. Question 2. Patient, I don't understand why I need insulin when I feel fine. Best response? You have to take it regardless. Let me explain how insulin helps manage your blood sugar. It's not your job to question. Insulin is only for very sick. Therapeutic communication involves education and empathy, not coercion or dismissal. Question 3. Which best assesses reading comprehension of a brochure? Glossary of terms. Ability to recite definitions. Patient's explanation in own words. Length of brochure. Teachback, patient explains in own words, confirms true understanding. Reciting definitions doesn't show comprehension. Question 4. What does OD stand for? Right ear. Left eye. Right eye. Both eyes. OD equals oculus dexter, right eye. OS equals left eye, OU equals both eyes. Misreading caused error. Question 5. Which statement shows understanding of antibiotics? Stop when I feel better. Save leftovers. Complete all 10 days even if feeling better. Take only with pain. Antibiotics must be completed fully to prevent resistance, even if symptoms resolve. Question 6. What does dyspnea mean? Shortness of breath. Increased urination. Abdominal pain. Vision loss. Dyspnea equals difficulty breathing. Dysuria equals painful urination. Dysphagia equals swallowing difficulty. Question 7. What does non-compliant with antihypertensive therapy imply? Medication ineffective. Patient forgets schedule. Patient refuses or doesn't take as prescribed. BP is normal. Non-compliance means not following treatment plan, whether intentional or not. It doesn't imply ineffectiveness or normal BP. Question 8. Choose correct sentence. The nurse and the doctor was in the room. The nurse checked the patient's vitals and recorded them. The medications is in the drawer. The patient's room is clean and neat. D is correct, past tense, subject-verb agreement. A C have agreement errors, D is fine but B is best answer. Question 9. Complete, the nurse explained to the patient and _____ family. There. Hers. There is possessive pronoun referring to family. There is location, there equals they are, hers is singular. Question 10. Choose grammatically correct sentence. The nurse who was tired quickly finished her shift. Nurses often works long shifts. Each patient requires their own care plan. He and I will administer the medication. D has correct pronoun case, he and I is subject. A. Finish should be finished. B. Work should be work. C. There with each is debated but D is clearly correct. Question 11. Which has subject-verb agreement error? The patient coughs during the night. There is several reasons for this symptom. The nurse gives medications as ordered. Each student prepares for clinicals. There are several reasons, plural subject. Others are correct. Question 12. Choose sentence with correct punctuation. Check the foresight. It looks swollen. Take the temperature, pulse, and blood pressure. Wash your hands before you enter and after you leave the room. Administer the medication every 4 hours and document. B correctly uses commas in a list. A has a period splice, C and D are missing commas before and in some styles, but B is best. Question 13. Select most concise correct sentence. The nurse who was assigned to the patient, she gave him his medication. The nurse assigned to the patient gave him his medication. The nurse who gave him his medication was assigned to the patient. Assigned the nurse medication was given. B is clear and concise without redundancy or passive voice. A is wordy with extra she, C is awkward, D is ungrammatical. Question 14. What does auscultate mean? To visually inspect. To feel or touch. To listen with a stethoscope. To measure fluid output. Auscultation equals listening to internal sounds, heart, lungs, with stethoscope. Inspection equals look, palpation equals touch, measurement equals measure. Question 15. The abbreviation NPO means nothing by mouth. Normal pull socks. Needs post-op nurse practitioner on call. NPO equals nil per os, Latin, nothing by mouth. Used before surgery or tests. Question 16. A patient is given a diuretic. Expected effect? Decreased heart rate. Increased urination. Lowered blood sugar. Reduced inflammation. Diuretics increase urine output to reduce fluid volume. They don't directly affect HR, blood sugar, or inflammation. Question 17. Which term means surgical removal of gallbladder? Appendectomy. Cholecystectomy. Nephrectomy. Gastrectomy. Cholecystectomy equals chole, bile, plus cyst, bladder, plus ectomy, removal. Appendectomy equals appendix, nephrectomy equals kidney, gastrectomy equals stomach. Question 18. What does PRN on a medication order mean? Once daily. After meals. As needed. Every hour. PRN equals pro re nata, Latin, as the situation requires. Given based on patient's symptoms. Question 19. What does tachycardia refer to? Rapid breathing. Irregular rhythm. Rapid heart rate. Chest pain. Tachycardia equals fast heart rate, greater than 100 BPM. Tachypnea equals rapid breathing, arrhythmia equals irregular rhythm. Question 20. Which term means difficulty swallowing? Dysuria. Dysphagia. Aphasia. Hematuria. Dysphagia equals difficulty swallowing. Dysuria equals painful urination, aphasia equals language impairment, hematuria equals blood in urine.